Hello and welcome, everyone. I'm Dr. Tom Chaney, and this is Living Health Live. Joining me on the show, as well as in my life and in our practice, Living Health Integrative Medicine, is my wife, Dr. Stephanie Chaney. We are your trusted source for the latest information to help you get and stay healthy naturally. We're super excited to be joining you and taking you on an adventure of a lifetime, your lifetime of great health. You're going to get information, strategies, and the latest research on how to live better and a healthier life. So just a reminder, this information on the show, it's intended as educational information only. Information given here is designed to help you make informed decisions about your health. It is not intended as a substitute for medical treatment. On today's episode, we're going to talk all about ozone and how ozone can actually improve your health. So let's get into it, Dr. Steph. Let's talk all about ozone today.
Let's start with what is ozone, because sometimes I'll recommend ozone treatment and people will look at me like, what is that? So everyone knows what oxygen is, right? Oxygen is two molecules of oxygen, O2. That's how it most stably is recognized. Ozone is O3. So it's three oxygens that have come together in a very temporary fashion. Ozone is an energized form of oxygen that contains three atoms of oxygen rather than two that we normally breathe and are in regular circulation in the atmosphere. It's the second most powerful sterilizer in the world and can be used to destroy bacteria, viruses, and odors. Ozone occurs readily in nature, most often as a result of lightning strikes during thunderstorms. That fresh, clean spring rain smell after a storm is actually created by ozone. It's that electrification of the atmosphere, of the oxygen, that creates that temporary O3 that we smell in the air. They try to replicate that with your laundry detergent and your dryer stuff. Ozone therapy is a medical therapy that's been used worldwide for well over 50 years. It's probably even longer than that now, with dramatic success and safety. And it's something that we use here routinely in the office for patients that have several conditions that are well-known conditions and some that are very mysterious with no actual diagnosis. We see great results.
All right, so that's what ozone is. So let's talk about how does it work in the body. And so if we get ozone into our system, let's talk about how that works.
Much like ozone is used in industrial purposes for sterilization and getting rid of odors, obviously that nice ozone smell is a good replacement for stinky odors. The extra oxygen atom, so O2 plus that third one, creates a very reactive situation. And what happens is when ozone is applied to the blood, it takes water in the blood, it reacts to it, and temporarily creates hydrogen peroxide. So water is H2O, ozone is O3. It temporarily creates H2O2, which is a form of hydrogen peroxide, and O2. And then what happens is that peroxide, which is something that our white blood cells routinely make when they're triggered to go and kill bacteria or any kind of foreign toxin, fungus, or yeast, the white cells actually spit out peroxide as a way to burn and destroy some of these foreign pathogens. So when we create that in the blood, it actually helps our immune system with destroying a lot of these pathogens. So it helps us handle chronic infections. Once it's used, it just returns to oxygen pretty quickly.
All right, very good. So that's how oxygen or how ozone works. Let's get into some of the additional details and some of the physiology and how that works.
Yeah. One of the ways it works is killing pathogens. Another thing that ozone does is it stimulates something called glycolysis, which is our cells' use and metabolism of sugar for fuel. And we know we have a huge epidemic in this country of prediabetes and diabetes, which is an excess amount of sugar, glucose in the blood. When you stimulate the cells to use and burn sugar and use sugar as a fuel, it helps to bring down blood levels of glucose. It helps make your system more efficient at metabolism. So in particular, ozone stimulates the red blood cells because that's the immediate impact on using blood sugar for fuel. And then that increases the red blood cells metabolism, energy production, and the effective release of oxygen. Because remember, red blood cells are the carriers of the oxygen around the entire body through the blood system. So it increases the effective release of oxygen into the cells and tissues of the body, and increases oxygen flow to all these tissues that might be oxygen starved due to cardiovascular issues and some other things. Ozone increases the level of antioxidant enzyme systems in your body, as well as their activity. So it helps the body to achieve an overall lowering and balancing of oxidation levels in the body. Oxidation is related to cancer and immune diseases, autoimmune issues, and it creates a potent antioxidant and healing effect in all of your tissues. That includes blood vessels and the heart. So it's very much indicated with issues related to cardiovascular disease, atherosclerosis, things like that, post-heart attack, as well as the nerves and the brain system. So any condition that you know to be related to the nervous system or the central nervous system or brain can be helped by ozone.
So it can be helpful for the immune system, organs, glands.
Pretty much the whole body.
The whole body. Absolutely. So ozone in medicine, how's ozone being used in medicine, or what are the different ways to administer it?
Yeah, so there's so many applications of ozone, and a lot of people don't even realize how much ozone is just routinely used even in the hospital setting, and may not be as a body treatment, but it's used in the medical world. Ozone, it just turns out, is one of the best healing agents and detoxifiers and sterilizers when used in medicine, okay? Not just in the hospital rooms or in your HVAC system to sterilize the air and the physical environment, but also in the body. One mode of using ozone in medicine is via IV or intravenous application, which is one of the main ways that we use it in our practice, where we're actually treating the blood through IV with ozone. Okay, so it's a direct application. Other ways of using ozone in a treatment form would be via injection. Joint injections, we do actually inject joints with ozone along with other substances to help with any pathogens. For example, some people get Lyme and other bacteria in their joints that cause incredible inflammation and pain. But those areas can sometimes over time be diminished in their amount of blood flow and therefore oxygen, as far as maintaining a healthy internal environment in the joint. So it helps with joint health. We also inject muscle. So we do intramuscular injections for trigger points and pain, just as far as the muscle system. So those are some injection modes. We also can do things like they're not injections per se, but they're with a sort of a syringe type application. We can get ozone into the sinuses. It's incredibly sterilizing to the sinuses. Most sinus infections are fungal. That's like basically from mold, yeast, or fungus, as well as other things like bacteria. Very sterilizing. But ozone right into the sinuses actually crosses the blood-brain barrier and allows for oxygen perfusion into the brain as well, which is amazing for the brain. You can also get it into the ears, something called ear insufflation through a special stethoscope. So we can do an ear application, and you can do rectal ozone, which is not a rectal treatment. It's basically like having an enema, but with air, because ozone is going to be in an air form, a gas form. So it's very easy to do. It's not messy like a water enema. It's very quick treatment. And it's actually a blood treatment that is the next best thing to an IV application. So the blood in the rectal area, the colon area, immediately goes to the liver And so when you're administering ozone, or quite honestly, any type of medication through the rectum, it's actually a blood treatment. It gets into the system. Okay. So that's a good thing. The other way to administer ozone in a healing way is through ozonating water and drinking ozonated water, or applying it topically. So it can be put into oils and administered as ointments and things like that. And then you can also do it via sauna. You can actually get administered. You don't want to breathe ozone directly into the lungs. So we have an application of a sauna where the head stays out. It's called a Hocket. And the system gets exposed. All the skin and pores are opened up really wide and gets exposed to ozone that way. So there's so many different ways of safely administering ozone treatment that can cause all kinds of good healing effects. Because of the antimicrobial and energizing effects to the blood cells, it can help balance and strengthen the immune system and help with chronic conditions, especially those that have been resistant to conventional medical treatments, which is something that we see a lot of in our practice.
Yeah, so it's pretty much sounds like it's going to be good for anything but the respiratory system. So you don't want to breathe it in. So
No.
Going back to that sinus treatment, we do it in a special way so it doesn't get into the lungs.
Yes, it is a treatment that patients can learn how to administer if they have an ozone kit and generator at home. But we do it here in the office to handle chronic sinus infections or sinusitis. And there's a way of administering it and getting it into the sinuses without you breathing it in. So there's a little timing with the breathing and that kind of thing. You don't want to breathe. It is going to be toxic to the lungs, almost a bleach. But beyond that, it's a very safe and easy thing to administer. And it's interesting, some of the cases that we've seen. One of our most recent, just interesting, bizarre, resistant to conventional medical treatment cases was a woman. I think we just got a video of her that we can upload the link to, so you guys can watch that after the podcast. But she came to us and had a really strange issue with vomiting, just constant all day vomiting. It didn't matter if she was eating or not. She was spontaneously vomiting, belching, a lot of issues. She had every medical test known to man. She'd been put on medications. Nobody knew what was causing it. And we ran a lot of tests. We do a lot of specialized metabolic tests, and it can take a few weeks to get some of the results in. And she was so desperate. She was worried that the enamel was wearing off her teeth because of all the vomiting. She couldn't keep food down. She was losing a ton of weight. And she couldn't go anywhere. She couldn't get her hair done. She couldn't go get her nails done. She couldn't even grocery shop because at any point in time, she would just barf. And so I think, Dr. Tom, you had met with her and had recommended, she was so desperate for something immediate. We just thought we could get you to do some ozone. You can start on that right away while we're waiting to get your test results back. We don't know if it will help, but it will obviously help in some regard because something was going on. And so she started Ozone IV, and she was so bad that she couldn't even finish the IV without throwing up. She would have to take a pause in the IV and go to the bathroom, or one of our medical assistants would have to help her wheel stuff into the bathroom so she could throw up while she was getting her IV. That's how crazy that case is. To this day, nobody even knows exactly what it was. But what happened was, over a few weeks and about 6 to 8 sessions of Ozone IV, she stopped vomiting, no longer throws up. She was so excited she was able to go get her nails done. And just those little things in life that make you feel normal and happy. And we hadn't even started doing any other treatment. We didn't even have all her tests back before she started feeling better. And it was the mysterious treatment of ozone that handled this mysterious condition that even conventional medicine couldn't handle.
But in addition to that, so the vomiting was her main complaint.
Yeah.
But she also mentioned to me that And this is something she didn't really bring up. It wasn't an urgent, and she wasn't in a crisis about it.
Not like the vomiting.
Yeah, the vomiting was, of course, top of mind, but she had lost hearing in her ear. And so she went to the hearing specialist, and sure enough, they said, yeah, you lost the hearing. She got hearing aid. And during this treatment, her hearing started improving. She went back to the hearing specialist, and they said, yeah, you have perfect hearing now.
Yeah.
So she told me she has this hearing aid she doesn't even need.
Yeah, spent thousands of dollars on a hearing aid she doesn't need.
Yeah.
And we didn't even know that the hearing issue was a thing, because obviously the vomiting was a bigger issue.
So ozone has a wide range of effects.
All we can think of is something must have been affecting oxygen supply to her GI tract, her vagus nerve, her whole central nervous system, and just getting all that oxygen in there. Who knows what pathogens might have been contributing to this? We didn't even have all the tests back to know at the time everything she was dealing with. But ozone handles a lot of different systems in the body. So, in fact,
yeah, here are some of the conditions that ozone has been found to help with. So, autoimmune diseases that's one of the things we see in our office so commonly.
Yep. So we work with a lot of patients that have a myriad of autoimmune diseases. We've used the application of ozone IV with ulcerative colitis or any celiac autoimmune disease of the gastrointestinal system, Hashimoto's, rheumatoid arthritis, psoriasis. We had a patient with ankylosing spondylitis, which is another really severe, progressive, degenerative autoimmune arthritis, actually get into full remission, and ozone IV was a part of his protocol. So we have a lot of autoimmune patients that we work with. Osteoarthritis, so joint degeneration, we always use ozone in our joint injections. We have a joint injection protocol to help with healing and regenerative aspects of joint. All kinds of infections, especially that involve the blood and the nervous system. So Lyme, viruses, hepatitis, herpes, fungal. So people have systemic yeast or fungal infections. Fungus cannot survive in an oxygenated environment. And a lot of the pathologies that people deal with have to do with low oxygen. When your body becomes low oxygen, tissues become hypoxic, low oxygen, you're actually more prone to overgrowths of yeast, fungus, bad pathogenic bacteria, and cancers. Obviously, ozone is a thing that we actually help as a complementary treatment for cancer patients. All of our patients get ozone IV if they've got cancer. So we want to hyperperfuse the system with oxygen. Chronic fatigue and fibromyalgia. So again, these are diseases that are caused by various long-standing issues with metabolic strain, especially due to biotoxins. So our chronic inflammatory response patients, often they've had it for a long time, end up with chronic fatigue. And a lot of that has to do with the lack of oxygen to the cells, which start to impact the body's ability to make energy. Your cells have something in them called mitochondria. Mitochondria are the furnaces of the cells. They take oxygen along with a whole pile of different vitamins and nutrients to make the energy for the cells. So if you do not have enough oxygen over time, you lose the ability to maintain healthy mitochondria and to produce energy for the cells. So people are walking around literally gulping for oxygen, gulping for oxygen, pretty much. Anyone that has low immunity, so autoimmunity is usually hyper, right? The immune system is hyper vigilant, hyper attacking, body's on fire. Many patients have low immunity, depleted immune systems, especially cancer patients that are undergoing chemo, radiation. It's very depleting to the immune system. And this is a way to actually support it. People that have asthma or COPD, you can imagine that a COPD patient is not able to get enough oxygen. That's part of what the condition causes. And so this is a way to help with any secondary issues with that. Dementia, Alzheimer's, Parkinson's, multiple sclerosis, and neuropathy. So all the neural stuff, the brain and nervous system needs lots of oxygen. And any cardiovascular disease issues. So post-stroke, heart attack, vascular These are important tissues that need oxygen for function and healing. So a lot of our diabetics have cardiovascular disease, which can be helped with oxygen and ozone. And any disease that requires any type of tissue regeneration can be helped with the application of ozone, either IV, topically, or some of these other modalities that we talked about, like injections and stuff.
All right, awesome. So let's talk about combining ozone with UV light, which is how we do it in the office. So we talked about some home treatments, and home treatments, we're using ozone typically by itself, but in the office, we're combining it with UV light.
Yeah, ultraviolet light. Again, ultraviolet light is something people might be familiar with as a sterilizer, right? There's even those little devices you can put your cell phone in to sterilize with ultraviolet light. And so ultraviolet light was discovered in America in the 1940s as far as a potential medical treatment and a disinfecting agent in medicine, but it was actually put off by the discovery of penicillin. But that's in America. In other countries, they continued using ultraviolet light around the world, and pretty much fairly unknown as an adjunct medical treatment in the United States. Now, because we've had all these superbugs and we just have been dealing with several years of COVID drama, ultraviolet light is being brought back to light, pun intended, as a replacement for drug resistance, treatment resistant infections and conditions, or as something to be utilized along with to get better results. And it's used in so many different industries to sterilize the environments, like hotels and hospital rooms. They disinfect food by irradiating it with ultraviolet light. So this isn't something that hasn't been around, but there is a way to apply it to the body in such a way that it actually works with the oxygen as a double whammy for healing and sterilizing, which means killing pathogens and things that contribute to disease.
How does UV light and ozone, how do they work in the body?
Yeah, so the two of them combined together amplify their effects and complement their effects. So all the things that I talked about that ozone can help with, ultraviolet also can help with. So it makes a super powered treatment for the system. So both of them together can improve circulation and oxygenation of tissues. They have both anti-inflammatory effects. So they can stimulate a low functioning immune system, and then they can ramp down and tamp down and relax and calm a hyperactive immune system. It helps increase tolerance of the body to chemo and radiation. So when they're used together, it actually allows a patient to go through conventional cancer treatment with much fewer side effects and less negative impact on the body. And it keeps their immune system strong. So one of the problems with chemo and radiation is people are very susceptible to infection. They have fragile immune systems. And this actually allows them to be able to maneuver around the world without having to be so worried about getting an infection, because it keeps their immune system and their immune counts up. It's helpful for cardiovascular protection via increased metabolism of cholesterol, uric acid, and glucose. So remember those things that the cells will burn. So it helps support metabolic use of those things that if they get too high, cause all kinds of problems for people. And both together, individually, they're both antimicrobial and anti-infection. Together, they're like able to handle almost everything. Ozone's been used in Africa quite successfully against Ebola. We've used it successfully against COVID. So some of the most nightmarish conditions and issues, infections, can get handled quite effectively, especially when you combine ozone with ultraviolet. And it helps, again, it amplifies what our white blood cells would normally do, which is create that potent hydrogen peroxide that just burns holes into these pathogens. Our cells love peroxide, but these pathogens hate it. It's very toxic to them.
All right, so let's talk about how they work together. And one of the things we were talking about is, and that I find it pretty amazing how it can help a person, whether their immune system is stimulated and it's hyperactive or if it's suppressed. And we see a lot of patients coming in with autoimmune diseases. So that's listed here. We can see autoimmune conditions, but more and more recently, we see a lot of patients coming in with suppressed immune systems, very low white blood cell count, and it will actually help boost that up.
Yeah, when the immune system's been stressed for a very long time, dealing with toxins, viruses, chronic infections, whether it be chronic Lyme or a chronic viral issue or parasites, chronic yeast or fungus, those things just keep that immune system in a constant state of hypervigilance and fighting. And eventually, over time, you can get very depleted. And so it is not uncommon for us when we do blood work to see very low white blood cell counts, not even in a cancer patient, just trying to maneuver through this crazy toxic world we live in. So it is very balancing to the immune system either way. The two of them together help with all kinds of conditions. They help cancer patients, bacterial infections, Lyme, chronic fatigue, fibromyalgia, neuropathy. All of our neuropathy patients get ozone IV. Diabetes, it's very helpful for non-healing wounds. In fact, it's indicated for non-healing wounds, ulcers, things like that. Most cardiovascular issues, all kinds of arthritis and joint issues, brain and nerve degeneration. It's almost like a necessity for everybody who has a body in today's world to do some type of ozone, oxygen, and ultraviolet therapy.
Yeah, and just so our audience knows, these are all therapies that we use. The things that we bring into the office, we use them personally. Mm-hmm. I use ozone weekly. So on a weekly basis, I use ozone just to keep my body functioning at a high level.
Mm-hmm. And once we've determined that a patient is getting good results with it, there's also a way to get them set up to do some home ozone treatments as well. This is interesting. According to the American Cancer Society, ultraviolet blood irradiation treatment is approved by the U.S. Food and Drug Administration for treating T-cell lymphoma involving the skin. Clinical trials look promising for the treatment of immune system diseases such as multiple sclerosis, rheumatoid arthritis, lupus, rejection of transplanted organs, and graft versus host disease. So that's something that the American Cancer Society has published on their website. As far as blood irradiation, that's not even including ozone. So we know blood irradiation is a viable treatment. It's used in medicine. It's nothing weird, but it's just not used regularly and as often as I think it should be.
So what is the procedure for a patient that's never experienced this? They come into the office, and what's the procedure like?
So the IV, you can see the picture here of somebody actually getting the IV application. It's actually pretty easy and pretty comfortable. So what we're going to do, you can either get an IV started with a manual pull of the blood, but we actually use a pump in our office. So it's really comfortable. It's easier for the provider, easy for the patient. So you have an IV put in, has a really long tube, and a pump will slowly start to pull your blood out. And through that tube, it goes through a UV machine. So it gets an ultraviolet treatment through a special tube that it runs through in the machine. And then it gets collected into a bag. You can see in this picture at the top right, there's a bag where this person's blood is getting collected. And so what'll happen is we have a certain amount of blood that we treat at one time. And then we have a way to insert ozone gas into that bag. So once the blood's collected, we treat the blood with ozone, and then we basically flip it and reverse track it. So the body we never actually have the blood separated. It's never taken out and treated somewhere else. It's all in a closed loop system. And so then the blood goes back through the tube, back through the ultraviolet machine. So it actually gets 2 ultraviolet treatments with our system, and then it goes back into the blood. And generally it takes about 45 minutes to an hour Of course, we start at a low dose and work you up. But the recommendations for IVs, depending on what kind of condition we're looking at, if you've never had it before, if we're dealing with a lot of our complex chronic patients, it's minimally 6 to 12 visits, usually weekly or twice a week if possible. And then after a patient's done really well with it and getting results, then they may just be coming in PRN or a lot less than that.
All right. That concludes today's episode. I hope everybody got some great information. Did you want to add anything else before we head out?
I think that's it.
All right. You've been listening to Living Health Live with me, Dr. Tom Chaney, and Dr. Stephanie Chaney. If you guys have any questions, health questions, you can always send your health questions to info@mylivinghealth.com, and then that will get filtered to us, and we can answer the questions on an upcoming podcast. Hope you got some great information, and we'll see you on the next episode.